Hospital, the intention is to design an accident emergency department in line with the Keown and Willett's review of emergency services, so it'll be the same as emergency services elsewhere in the country, and that will be implemented in full at that hospital. It will take appropriate patients to be admitted onto the site, but also be able to care and stabilise people that go there and that need transferring elsewhere. So the changes at Ealing Hospital A&E aren't planned for some years. At the moment we're in the process of implementing improved care in the community and in general practice to mean that fewer people need A&E. That's the first part of work. After that there's a rebuild of the new hospital, and in 3 or 4 years' time we're at a stage where we can possibly make changes in the accident and emergency and change the work it takes. There's a separate piece of work that the local CCG are doing with NHS England to review the ongoing activity of both maternity unit and paediatrics. Potentially they could change next year, but the CCG are still doing the work to check that that's the safe thing to do. At the moment the CCG are working with the Imperial Trust to design a new local hospital at Charing Cross. Certainly the local hospital will be smaller than the Charing Cross is at the moment. There are opportunities that the local hospital could be in the tower block, or they could build a new local hospital and use the tower block for other things, or it could be knocked down to make way for other facilities. That CCG is working locally to design that at the moment. At the moment we're reviewing that. We don't think the changes at the A&E at Hammersmith and St Thomas are the major impact on the local hospitals. We think there are many other factors going across London. We've asked for an external review of experts to come in to review that and see if there's anything we need to learn to get right. But we think A&Es across the capital and indeed across the country have become busier. We know that the A&Es at Northwick Park are safer now than they were before. We have fewer locum nurses, fewer locum doctors, and larger teams of doctors and nurses providing care over a wider range of areas. So we're quite clear and have evidence the safety is better. Performance isn't as good as we'd like it to be, and we're reviewing that and working with the hospital to make it better. Absolutely. So certainly there's a national review of emergency departments, and we will make sure that the emergency department at Ealing and at Charing Cross is in line with the recommendations from that process. It will take ambulances, it will be able to admit people, it will have emergency services, will be able to resuscitate people. So it's an emergency department, absolutely. No, I mean, the Shaping Out the Future has been a 5-year programme. Local doctors working with the local population to design a better service for patients. We're in the early stages of implementation. We had to change 2 of the A&Es rather sooner than we'd hoped in our original plans because of the safety issues that those 2 sites had. We're now in a much slower process of redesigning and rebuilding the major hospitals, where we're investing large amounts of money, but also investing in community and primary care. We're absolutely not pausing in doing that work because improving patient care needs to happen as quickly as possible. That doesn't mean that people will see major changes to their hospitals in the very near future, because these things take time.